Boy, what did you rub against, dude? Like, honestly, for a horse, that's not a big bladder. See all that sludge on the bottom? See all that bright? Yeah. I was gonna say, his back left looks bigger than his back right. His front right looks bigger than his front left.
I concur with the floppy diagnosis.
Tales Refuge is a full circle of life shelter founded in 2014. As a full circle of life shelter, we take in any horse, mule, donkey, or pony, no matter their age, size, breed, or training. Regardless of their background, we have never turned an animal in need away. Even after 10 years and over 1,100 animals that have come through our gates, you just never know what's going to happen. These are the horse rescue tales from the Tundra.
So we had a pretty big list for Val the last time she was out, and she wasn't able to get through all of them. So she is back out today to finish the rest on the list, and hopefully we get some good news.
Okay.
Not bad though.
That's kind of what we were wondering, if she'd be like bareback riding.
Yeah, like kids.
Well, here's the thing. If you have I would go with potentially light rider. There's nothing to say that she couldn't necessarily be saddled if you can get it off. You'll make sure there's, and you don't want contact anyway.
Yeah.
But making sure that you have a really good clearance there, I think potentially we'd be fine. I've seen way worse, and the animal was still sound. Despite the fact that we have like no thoracic trapezius there. Okay. Anything else going on with her besides the fact that she likes to pick fights?
She's just got some crooked feet, but Polly put some shoes on for that, so
No.
kind of just her withers at this point.
Okay. Can I watch her move? So whether she's being lame on that right hind because she's picking fights or what, I don't know. But she's not moving that hip very well. Oh my, honey, yeah. Yeah, she's not just crooked foot. She's like, that left front goes over here. It's the wrong side for that. Okay. Ooh, yeah, a little sore, aren't you? That's because you have no muscling. You gotta bump you up. Can you lift it? She says no. So do we know what this is from? Because
It's a skid steer bucket.
Yeah, she got in a skid steer accident.
Were you driving?
Wasn't here.
Okay. You never know.
We imagine she ran and bumped it.
So that may be contributing to some of this, like the scar tissue here could be contributing to a lot of this muscle wasting. I have a feeling she's going to need a little bit more. If there's nothing to say she can't be ridden with what I'm seeing right now, but I think she's going to need some decent rehab to fix this. This is going to make it so she's not able to lift that left front. Yeah, this is the one that she crosses over, isn't it? Mm-hmm. Okay, so I think this is the big reason why she's crossing this over, because this muscle brings that shoulder blade up here. If I'm trying to advance my limb and I don't have anything that's holding it here, it's going to drift over. But when she stands, she's fine. It's not like she's standing over like this. So we'll see if we can get this stuff moving and then get some rehab for this left forelimb. I'm assuming she can pick up both front feet, like for the farrier, because she's shod. I think she's going to end up probably being one of these that we do the rehab where we pick up the right front and then do the gentle sway. You guys remember that one? I can show it again. Whew. Sheesh. Here, give me a workout. So overall, I think she's going to be a great one for having a hilly pasture because she also has like no middle glutes. We don't have any junk in the trunk. We need a little bit of junk in the trunk. She's going to be a great one for carrot stretches too because she's just so generally stiff.
Just making her put weight on that side.
Yeah, I mean, that's not a normal response. Usually it's just, yeah, I'll dig in. It's not like, here, let me do a flamingo thing. She has strength with resisting that lateral motion. That's good. It's a start. Well, hey, we can lift up a little bit now. Something. She's really going to need belly lifts. She cues pretty darn hard for that too. Better. Okay. Even though she doesn't think it.
You think just proper saddle fitting and
Yeah.
heavy rider type
Yeah,
fit?
you're going to have a lot of trouble with getting something that's not going to interfere with the scapula because you don't have any muscle padding right here. So she's probably going to need some pretty good shimming. And you're beautiful. As we're building this up, she's got a really good amount of scar tissue too. I don't know, we'll see. It can actually build up, but it's going to be started with the, especially the belly lifts, those sternal lifts. So her strength is good, but we're looking at trying to build up that trapezius as a stabilizer on that other side. So doing these sways on one leg, I think, is going to be helpful. She's going to be she's going to need the multimodal approach kind of thing. Like, it's not just going to be like this exercise is going to fix it. And with her, because she's already equal strength, well, now you release. Same number on the right as on the left. She was strong. I think you can easily do like 30 seconds to a minute of that a couple times a week. Do several sets a couple times a week. And then the sternal lifts are the big ones. Butt tucks are going to be good for trying to keep that low back going. Carrot stretches are always good because she's just so stinking stiff. If this is, I know you guys have all the time in the world to do all of these things. I would focus on the, hey, we're getting ready to groom her to take her out and work with her. Do the weight shifting and do the belly tucks. Those would be my top two with her. And stop fighting.
That's side eye.
Yeah, she's like, no.
We haven't had a Petrie before, but
Huh. Okay.
I'm trying to think. Can't think of one that might have had the same name. Patrick.
Okay.
I don't think you ever saw that one.
How old?
He is 21, I believe. Yes. Oh, his tail. Okay, so when Kristen was looking at him over in quarantine, oh boy, she must have found a treat. When he lifted his tail up to poop, it was very floppy. Like he didn't have much control of his tail, if that makes sense. He
Yep,
didn't really
it
lift it up
does.
all the way. And he looked a little uneven back there too. Asymmetrical.
That's a good word.
Yeah.
But I want to fluff it. I'm sorry. You are too stately for that, aren't you? I'm sorry. I am going to floof that later, though. I mean, I can feel a little bit where he's like, I don't want you to do that, but not much. I concur with the floppy diagnosis.
It looks like this side is higher.
Yeah. Oh, and well, pretty square. Sensitive, going to the left, so that would indicate that we have sacral apex on the right. Yeah, I would say we have less tone to the right, so I'm guessing we flop more to the right. Not particularly sensitive. And we don't really know any history? Okay.
Nope.
He has anal tone, so I'm assuming he's not having any problems actually defecating.
No.
And you haven't seen any hind limb lameness, especially like right side? Okay. Well, and if we've had injury, especially back here, which is kind of weird looking, totally the medical diagnosis, we can injure the innervation to that tail. I'd have to review the innervation with, like, anal tone is still present. It's not super robust. So that might be where we're straining that it's hard to actually control that for him. We're not horrid at all. It's just weird. I would guess he's had an injury to the sacral apex, and that's changed the how he's able to activate that tail. I love your mustache. So right side of the tail has less feeling and less motor than the left. Yeah, what are you going to do about it? And it's also what does it actually change? I don't think.
He rides good.
Yeah. As long as, if it were higher up, we could potentially be affecting how the hind leg is moving, but me? Just makes it more unique, right? Okay. Done. Mike. Dude, you are like, grr. Love it.
Not really necessarily any concerns with him, just his back is fairly obvious.
You're ready for winter.
Yes.
I love it. Hi. He's like, I saw you play with that other guy's mustache. Wow, buddy. You're handsome. You are 100% handsome. Wow.
What's wrong with it?
I don't make the news, hon. I just... You could like sit just on this shelf. Interesting. Okay. Okay. Not painful. Hi, you're handsome. Okay, well, we don't have a turtle left. Well, what? Okay, interesting. Can you walk, please? Dude, you are like a tank. It's freaking awesome. Wow. He's working really hard not to move that pelvis up and down. He's like this. Walk. We'll see what we can get fixed on you, sir. No, he doesn't have any reaction. with digital palpation along that back. So this, yeah, I said before you were handsome. Oh, look at your one up top. The only thing that could make him better is a mustache. You might want to work on that, sir. We'll see what we got. This may be just a mechanical issue. If we don't have any pain, we'll see. I mean, it doesn't move normally, but for the deformity, it actually moves decently. A lot of times these guys are super locked up. Pelvis moves. I'm not sure why you can't roll that. Really nice lateral motion. Just because you're not like everybody else doesn't mean you're not beautiful. Nothing. So, and this is like these, sorry, that it was a little dramatic how I set that down. I can understand. The lumbars don't move normally, but for the anatomy, they are probably moving pretty good.
Basically working with what it's got.
Yeah. That was like the one super crazy kyphotic horse. Well, we've had a couple of them. Some of them that were like this and others that were like this. As long as they're moving all right, it's one of those, well, we're not fixing the anatomy. As long as the anatomy is working,
Right.
I just
What's the issue?
go with it. Because this pelvis, man, that's nice. Your boot is working, dude. Okay, so not quite. Well, it's not as loose as that left side. Well, there we go. OT. You gotta be able to shake what your mama gave you, honey. You look so concerned. That's fine. Let's have you walk down and back again. We'll see if we changed anything. Well, a little bit better, but that's still, I'm wondering if we can't just rotate as well on those lumbars because they're so high. You might be an interesting ride. We'll see. He's not sore. So I don't see any reason why you can't be working with him. Yeah, I would do light. Somebody light and light riding as well. But see how he goes. If he's not developing soreness, I don't see any reason why he can't do those things. So, Keel.
All right. Oh, it opened up more. So you notice it was open on Saturday, just right in the corner.
Oh, yeah.
Inside corner. Now it looks like it opened up more.
Boy, what did you rub against, dude?
I think it's leg.
Oh yeah, look at that.
And the flies are supposed to be gone. Too warm.
So,
I'm trying to decide. Like, I could re-sew it, but I could only re-sew 3/4 of it because I got to leave a corner to drain. Meaning I'd leave that front corner open to drain. And I would do it standing because it's just a quick thing. I'd get them in the stocks, sedate them, trim the edges, and my worry is twofold. One is that he just finds a way to pop it open again no matter how I sew it. But I'm also worried if we don't sew it, ultimately it's going to have to get closed. Because if they don't sew, they turn into this nasty granulation ball that you'd then have to almost debride and then close. So I think it'd be better to try to close it except for the corner right now and hope that it'll stay shut. Because I used a bunch of fairly thick unabsorbable suture, but maybe I double sew it, or I don't know. Try again. It shouldn't take out long. If we get him in the stocks, he's pretty good in the stocks. And once he's sedated, then it'll, like I said, hopefully it'll take 10 minutes. I'll have to snip that, freshen up that edge. I think we should have enough, hopefully, to still get it closed. And then just sew that, then block it, sew it, and keep our fingers crossed you don't tear it open again. That's what I'm worried about. But
All right, buddy, to the
I will
stock.
leave that front corner where it's really wide open. That's going to stay open.
Okay.
Because there's no way closing that's going to be the right thing, because we want it to drain now that infection's in there. And maybe part of it was there was infection in there from before. Did you send that tissue off? I did. Yeah. I don't have results yet. Or if maybe they came in today. They weren't there this morning. But easy, bud. You're okay.
Oh boy.
Boy.
Oh, buddy.
He's moving. He's acting calmer than he has.
Good job.
Good boy. You're a good boy. You did good. You're not quite as wild.
Yeah, all the
help his
pressure
person.
from it.
He does seem to kind of mellow out.
Yeah, I was going to say he's acting a lot calmer, so. I couldn't, but I don't think I'm going to pull all the stitches out right now. We're just going to add some more.
Okay.
Just because they are holding a little back here, and they're interconnected. So if I pull out this whole line, I don't know if these will hold at all then.
Okay.
I'll just start here, and I'm going to re-sew it twice like I did before and freshen the edges, and we'll see how it holds. I'll freshen the edge here so we have a nice clean edge to sew it to. Take a little bigger bites in hopes that they hold a little better. Hey Brooke, can you run to the back of my truck? There's a bag on the right side, it's like a tan bag. Inside it, there's like a package of a whole bunch of suture. I'm going to use this and then I'm going to switch to that suture just to double up our job here. On the flip side too, we had all that pressure when we first did it.
Yeah, now that's kind
That
of
pressure's gone. The one advantage of it popping open is it's an empty socket now, so hopefully this is significantly stronger than what we used last time, so hopefully that'll hold it better. Plus, like I said, we aren't going to have the pressure behind it like we had after surgery last time. So I'm optimistic. So I did leave a little corner open here in hopes if it gets infected.
Some snowboard goggles.
What it looks like.
Horse size.
Those are kind of cool. Well, buddy, so if you see it, I'm hoping it should hold well, but there is this point right here I did leave open in hopes that if pressure builds, it can drain out of it.
Okay.
Now, I didn't throw a drain in there, which I maybe could have, but I'm hoping we don't need a drain because maybe there won't be a lot of drainage. But.
All right.
Dave's got his ultrasound machine with today, and we're gonna take a look at BZ, which, if you remember right, she had the urine leaking out and it was irritating her hind end. So he's gonna take a look and see if there's anything internally going on.
See all that swirling? Mm-hmm. That's urine in the vagina. You don't normally see that much fluid in the vagina. So that's a uterus there.
Okay. Nothing in it, that's good.
It has that swirling in it.
Oh.
So it's got urine in it.
Or pus, or
Oh, okay.
not a real clean uterus.
There's no baby.
None of that, you side.
Where are we now?
That is the bladder right there. So there's the trigone of the bladder. See how it narrows right down there?
Yeah.
So her bladder is very small. I was expecting to find a monster bladder. Like honestly, for a horse, that's not a big bladder. See all that sludge on the bottom? See all that bright white, that sludge on the bottom? And then we go to the trigone here. This should be where the, so you see how it kind of pinches off there? Mm-hmm. It's interesting to me. It's like she has control, because see how that's completely blocked off. There's no stones there. There's nothing bright white. It looks like it's, you know, I think it's her conformation, meaning her vagina's tipped down so it doesn't squirt out. It just kind of dribbles down when she goes pee. Does she? You said she dribbles all the time though?
Pretty much.
It also seems like big motions and movements. It just kind of spurts out.
Spurts out.
Yeah. Otherwise, it just kind of drips and drains.
I was thinking I'd find a really big bladder in here that she can't empty, right? But me looking at the bladder, not that it's not big-ish, but it's not humongous. So that's the other uterine horn. See all that sludge in there? No babies in that uterine horn, though. We didn't expect her to be pregnant, though, right?
Right.
Yeah. But I would say, well, for sure she's open. We can see both uterine horns full of crap. And then her vagina pools urine. So I'm kind of wondering, based on me looking at her, is I wonder if her vagina has been torn from having babies and it pools the urine in the vagina. Meaning basically the urine sits in the vagina when she pees and then sloshes out because because the bladder to me looked normal. But the vagina and the uterus look nasty. So my wondering is if during foaling, if she tore her vagina, and that's creating, there's a blind pouch in that vagina that I think urine is collecting and then sloshing out of when she pees.
So it didn't tear the outside of it, tore the inside of it.
So what are her options?
You know, again, it'd be easy if it was just like a Caslick, but she did anatomically doesn't look that bad here. She's not like she's tipped way out or. I'm gonna have to read up on it, to be honest with you. Up, easy,
That's got to be really irritating for her.
up.
She don't like that.
Sore, isn't it? So basically what's happening is normally, you know, when you pee, the urine should just come out of the base of the vagina here. But for her, it's actually going backwards into the vagina. And then I'm sure it's awfully sore because that's not an environment that's meant to have urine sitting in it. And then when she walks, it sloshes out of the vagina. So that's what's happening. How to fix it? I'll be honest with you, I don't know. I'll have to see if I can find anything on it and if there's a way. You know, externally, Caslicks are easy, but it's not external, it's an internal. And it's not like a new, oh, she just folded and she tore it and we can surgically go fix it. This is old.
How's that skin doing down under too? Because that's been getting real
Well, that skin's nasty.
black and
not just there, like I said, look it in the vagina here. Look how sore that is.
So it's not neurological, basically.
I don't think so. I think it's actually anatomical, which again, I didn't know until we looked.
Right.
Because the bladder isn't big, it's not extended out, it's relatively small, it's like this big. But that vagina is crappy. And I don't think it's the way she was born, I think it's, she had some kids and it caused problems. And what to do about a torn up vagina? You know, got a hoof stuck somewhere, who knows what, but there's a lot of options. There may be a surgical correction of it. That's it. And whether it's a very easy or even a very successful one, I don't know.
okay.
I'll talk to people, meaning, you know, I got 8 doctors at the clinic, Dr. Schmidt and a few other ones, and probably chat with them and then maybe see if, reach out to Dr. Topline Equine. She does a lot of repro work.
You think just keeping her cleaned up until...
Keeping her cleaned up. pain meds, antibiotics. She's been off antibiotics for a while now. She was on Doxy. I don't want her on them always, but I would wonder about cleaning up. Like the uterus nasty, the vagina's nasty. You know, we could do an antibiotic flush for vagina and uterus. I just don't know how long we're getting by doing that, meaning it'll flush it out temporarily, but if that urine flows backwards into it, it'll just happen again.
Yeah.
So that's the hard thing is, I can think of a lot of temporary comfort measures. I don't know if I have a permanent fix.
Right.
Okay.
I'm done messing around back here. I'm sorry, girl. You're a good horse.
Okay, so we are done in the barn and we are now heading down to quarantine to look at the new auction horses.
So these guys don't have names yet. I just have their tag numbers.
Well, he's better than my 3-month-old.
Right, that's what I'm saying. Good dude.
400?
410, 411, yeah.
Why is the one bigger than the other? His right one's bigger than his left one.
I don't think you have any matching legs.
I was going to say, his back left looks bigger than his back right. His front right looks bigger than his front left. Front left has lax tendons. The back has almost 2 straight.
What's going on, kid?
You are not very conformationally sound, dude.
So that's why we.
Your conformation is not good. I don't know who your parents were. You pick feet up? Oh, good boy. Someone's worked with you. To shoot extras of his cuboidal bones if they're properly formed.
Of the what?
Cuboidal bones? Yeah, just the way his legs look, I'm like, does he have malformed? Maybe they're fine, but it just looks so odd to me. I don't know. I can't place it, but they ain't right. Because this one's swollen. That right knee is swollen. The left knee is fine. Got a pair of jewels.
Both there?
Yeah?
Hey. Good job, buddy. You guys gonna come in? Go boy.
There you go.
Very nice. 1120. I think
4
he's got.
feet shod. Do we know why? Just came that way?
It's standing, that's always.
Yeah. Because there probably was an Amish horse on a
Yeah, yep.
cart or on a.
All Amish. Can you just hold for a second so we can shut the gate?
The only thing I noticed with him is
Yeah.
the eye.
That eye is.
Yeah.
See the other eye? Easy. This eye looks normal.
I surprised him when I walked up on his left side just now.
I don't think he's got a lot of vision in this eye at all. I cannot see through the lens. Because that looks to me more like cataracts and anterior uveitis.
He's only supposed to be 3.
That's what I think. I think he might have a congenital cataract.
Okay. You're all right, bud.
You know, versus like the blue. Oh yeah, he's a baby.
He's a youngie. You chipped your tooth.
Broken.
Yeah, he has
Oh,
double broken
puppy.
teeth there. He's got 2 broken.
Or are they just the baby
No.
one shedding?
I don't think.
Looks like some damage there.
I think there's some trauma.
You're okay, baby.
You're okay.
You're all right. I think there's trauma. I don't think it's. He's gonna have adults come in there, so nothing's permanent.
So you agree with 3?
Yeah, he looks about 3.
While you're done running, it'll be okay.
You got a group of babies here, huh? You're fine. Boy, he's jumpy. Someone, I think.
The only thing I guess I did notice is left behind you can kind of see on the way back. There's like some. You want to turn so you can see. You see that looks like maybe an injury back there.
He doesn't really act lame on it at all, though.
No.
So a left congenital cataract and a right rear suspensory ligament injury.
All right, what do we got? 8, 10? All right. All right, so he's supposed to be about 8 months old.
Look at your teeth.
Stay in here and keep them coming.
You're acting like an 8-month-old. Hey, you're fine. Good looking. Oh, baby. Yeah, he's under a year. don't lift your feet like your baby friend does.
Doesn't mind that, but don't touch my feet.
So, I cannot feel his right one.
Okay.
So left is descended, right I don't feel.
Okay.
And he was letting me feel pretty good. They might be run up, like I can often find them, like, well, I think there's been 3 here that haven't been able to be found, that once you sedate them, I can fish them out.
All right.
All right.
All right, dear. Oh, no.
You're okay, baby.
Your friend's coming too. Just you first. Good.
11? Not quite, huh?
I'd say 10, 50.
Okay. This girl's supposed to be 16.
Yeah, you still got milk. You might have just got your baby weaned. That's why they sold you? You weren't good for anything then? I know, that's not very nice to say, is it? Hyperkeratosis in that eye. There's an old ulcer in this right eye. Left eye.
So her right eye is okay? That was the one she couldn't see out of, but maybe not.
Not seeing great out of it. So you see, like in the iris, there's some hyperkeratosis, like basically, like normally that slit would be fully open. Do you see that? And then there's that pigment right in the middle of it. I think she has visibility, but I think she has limited visibility in both. Like she can see out of both, I think.
Okay.
But you can see, like she sees my hand. It's interesting, she almost sees worse out of this eye. But she still sees. Yeah, you can see. I think you might have some mild vision deficits, but she's not blind.
Nothing we can really do to correct any of it.
I don't think so. Doesn't look like typical like moon blindness, you know, anterior uveitis. It doesn't look like that at all. I'd put her about 18, 19, but they have papers at 16. I don't disagree with
No, that was just her birth, what they had the birth date on the Coggins. Yeah.
I would say upper teens.
Okay.
Don't feel any mastitis or anything. Feel good. I'm not going to strip them out or anything. We want her to dry up, so. Yeah, down here around the fetlock, there's a lot of scar tissue.
Okay.
My guess is cart horse kicked it with the other foot. You move her forward. She seems pretty sound though. All right,
All right, girl.
you're done.
All right, dear.
You all know how much you weigh now? Really? You're not even 1,000.
980.
980.
Okay. About 18, they said.
Yours isn't cataract. That's more typical moon blindness. Lepto. There you go. Wait.
Sorry, I wasn't balanced.
Not really much scarring or anything there. She doesn't have feet. I think probably because of her blindness, she was probably just used for breeding. I don't even see scars like she's had shoes anytime recently. Tells me she probably wasn't used for driving much recently. You're fine. Hey. Yeah, she's picking it up nice. I'm just being the scaredy cat. Got a little scar down here. Didn't seem to really bother her though. Get up. There we go. Good. She's got a good scar there.
Is that a scar down there too?
Right here, yeah.
Oh, right here is where I was.
There, yeah.
Okay.
And across here,
Okay.
like one of those wire wrapped around things.
Caught up in a fence.
You're fine. She's a little spooky, but I think it's just because she's blind.
The other eye's good though?
Yeah, everything I could see, she seemed to be able to see out of it. Didn't see any abnormalities in it. Yeah, she looks good.
All right.
Yep, no heart or murmurs or arrhythmia.
All done. Good job.
Go, Bobby, go! Gonna come running back? Yes, I am. Woo! You're a goofy kid. You think one more time? Thinking about it. Might eat. Oh, no, one more time. Woo! He loves his turnout time with Envy. Coming back? Slowly? One more oomph. No. That's okay.
Okay, me and Eliza are taking Dara and Petrie out on the trails for the first time at the rescue. So far, so good. They're both very chill and calm. All right, we still have our Halloween stuff up, so let's see how they. Oh, like what the heck is that? Good boy, Petrie. Oh, didn't even care. They're both doing really good. We just went past the tractor. They have not spooked. They just kind of stare at it and like, what is that? Officially no better sound than horses' feet in the leaves. Well, not scared of whatever this thing is. Spooky. If anyone's wondering, me and Liza's favorite thing to do on the trail is yap. We're just yappers. Yap the whole way. Certified yappers. Petrie's kind of leaving us in the dust back here. We're kind of slow. Petrie's got speed. All right, we made out of the trail with no spooks, no worries, just slow. Yeah, we're just slow. Ooh, yeah, big girl. Oh. We lost our go for a second. Little Bobby. He's like, what the heck?
So today we have an owner surrender coming. We're not entirely sure what her name is, but what we do know is that she does have some arthritis, and it's something that her current owners just aren't able to continue taking care of. So they brought her to our shelter and they should be arriving shortly.
Hey, girl. Hi. Aren't you pretty?